Thanks for staying with us. This is The Pulse. Now, we can now hear President Akufo-Addo, who was speaking at the 63rd Independence Day celebration in Kumasi with a message for persons living in coronavirus high-risk countries.
63, we know that we have squandered many opportunities that properly utilized would have brought us to the economic breakthrough to which we aspire. We lament, and rightly so, the infrastructure deficits that plague all sectors of our lives, and the considerable number of our people who still live in poverty. But if truth be told, we have solid reason to rejoice and be thankful to the Almighty, for this is a blessed nation. It is a good thing that we are usually so very hard on ourselves, and the critical voices sometimes drown out everything else. For as long as we have not achieved our economic goals, we cannot and should not relax and be complacent. However, we should learn to count our many blessings and not talk ourselves down unnecessarily. It surely must count for something that our nation has been spared the ravages of the medical crisis that is bringing in its wake death and economic difficulties and is spreading fear and panic throughout the world. In the early days of the outbreak, I constituted on 7th February a high-powered emergency response team to handle the crisis, which has been monitoring developments and reporting to me on a daily basis. Strict checks at our entry points are being conducted with rigorous screening procedures. Isolation and treatment centers have been designated for potential cases, and a quarantine center has been set up. 5,000 personal protective equipments for health workers have been procured and distributed to all regions and major health facilities, points of entry, teaching hospitals, treatment centers, and selected health facilities. Additional protective health equipment is being procured. Training of health workers in the treatment of the disease is being provided and is ongoing. In the interim, non-essential travel into Ghana is being strongly discouraged from high-risk countries, namely China, Iran, Italy, Japan, and South Korea. We're counting on the experts to do their part to safeguard us, but we all have a responsibility to take measures to help ourselves and each other. The recommendations are for each one of us to practice basic personal hygiene and be extra careful with sanitation. For the time being, as the Ministry of Health has advised, we have to revisit our custom of shaking hands.
On the subject of coronavirus, we've been joined on the line by Dr. Bedu Sarkodie, who is Head of Public Health at the Ghana Health Service. Dr. Sarkodie, please brief us on the status of this case that was tested and has shown negative.
Daniel, a bit louder, please.
We just want you to update us. Right. We just want you to brief us on the tests that were carried out and how you arrived at this negative result.
Right. Thank you very much, Daniel. We had a report of suspected case of COVID-19 in Korle Bu yesterday, and the necessary steps to get samples taken to send a sample to Noguchi, and then Noguchi, doing the assessment, has finished with the investigation, and they have come up with a report and shared with us, indicating that they have done the test. And what they do negative control, positive control on the samples sent to them. They do extract what ever, if the germ were to be there, the virus, they're using molecular tests to assess if the virus is within the sample that was taken. We have done all that is required, and done it again, and indeed the report has come up to be negative, and we've given us that report from Noguchi Memorial to Medical Research.
We understand that this brings the total number of cases tested negative to 46 locally.
That's correct. Indeed, for every suspected case, sample has to be taken and sent to the lab for the necessary investigations, laboratory investigations to be done. It's only by lab that the confirmation could be done. So this one added that to 46. All of these have been investigated in the lab, and all of them have tested negative. So for now, we can be very definite that we don't have a confirmed case of COVID-19 in Ghana.
For the sake of listeners who may not have been updated on this story, what made us suspect she may have coronavirus in the first place?
This was a woman who is a Ghanaian, lives in the United States, and she came to Ghana purposely to undergo a gynecological operation. And indeed, as part of the preparation, they did everything that they should to prepare her. And just a few, and I think even the surgery might have been done. Then a few hours or so after the surgery, she spiked temperature. And then further interrogation indicated that coming from US, and indeed in US, they have confirmed cases, but then it's not very high-risk country. But then the woman herself indicated that within her flight, there were quite a number of people with possible respiratory conditions. So he thinks that based on this, the clinician had the suspicion that they have to consider assessing this very candidate or client for COVID-19. And that is the rationale for the suspicion, and the necessary steps have been taken, and the report is negative.
Now, Dr. Bedu Sarkodie, in the last release put out by the Health Ministry on our preparedness to deal with the coronavirus outbreak, we understand that some 5,000 PPEs were procured by the Ghana Health Service and the Health Ministry. We know PPEs are used and disposed of in some cases. How many of these have been used? How many have been allocated to Korle Bu, for instance?
The 5,000 have been sent to all the respective areas that potentially could be suspected cases, and we've sent some to areas where potentially we manage cases. I'm aware that Korle Bu, they had not less than 100.
Right. So in a case like this where Korle Bu has had a coronavirus scare, one would expect that some of those have been used. What's the plan to replenish them? When are we making sure that...
The line is a bit strange. I can't get the entire...
I was asking that since we know that we've had a suspected case, one would expect that some of these PPEs have been used. So when are we going to replenish those resources? What are the plans to get more PPEs?
Indeed, I am aware the minister has requested for 5,000 more, and even there are plans to get more. Some of the partners have even given us, WHO has given us recently some quantities, and we are not waiting to deplete what is available before you get more. So plans are in place to get more as required.
Now, we understand that this woman, because she came for a gynecological procedure, was kept in a single room of the 6th floor of the maternity block. So is that where we have designated for isolation, or the isolation ward, which the Director of Public Health for Korle Bu called for its refurbishment, has been prepared?
Prior to, the woman was not being assessed for COVID. She was being assessed for a gynecological procedure, as you already mentioned. And I think that area where they sent her, not for the purpose of COVID-19, but then she was sent there purposely for the gynecological procedure. Having been sent there already, and later there was the need to evaluate her for the COVID. indeed, it's important that wherever you are, you have to minimize movement. And that was why this woman was made to remain where she was and not to move around too much. For if it happened to be a positive case, not to contaminate the environment further.
I was asking, sir, that the last time we spoke to the Director of Public Health at the Korle Bu Teaching Hospital, he complained that the initial isolation ward, which was set up for Ebola, for fighting Ebola a few years ago, had deteriorated. Has that isolation ward now been refurbished?
I know that they have a place, but then we need to further go and inspect their situation for now, because we had the information that all the teaching hospitals have some place that they can potentially manage cases of COVID-19. And then we also are aware that some of the staff at Korle Bu have been trained and are part of the rapid response team.
Dr. Bedusa Korle, the question that has been raised within the medical community has been away from the major referral centers, the primary healthcare facilities. What checks the Ghana Health Service and HEFRA, for instance, carrying out in private hospitals in the first ports of call when people are sick to ensure that they have the right PPEs, they have the right equipment to deal with a possible coronavirus case?
We've had engagement with the private medical practitioners at their places of work during one of the meetings. And I think one of the annual general meetings more than 2 weeks ago, I went there personally and made a presentation, and that the various guidelines we prepared as a country, we shared with them the guidelines. The leadership of the private was there, Dr. Morrison, and we have had meeting with him about 2 further operations and what needs to be done. We have discussed with him and some of them directly, the private practitioners. The PPEs that we shared, I think they were giving some quota, which I believe that considering the number of private facilities in the country, we cannot share entirely some reasonable quantity to them. So the advice is that as much as possible, each of the practitioners should do best to get some to complement what will be available, and that it's important that all practitioners, having in mind that we will not be very definite and very clear where a case suspected may come from or may be seen, it's important that we get the needed PPE. And this is what the discussion that has gone on. I must admit that we would not be in position for every private provider to give all the PPEs that are required. So we require that we also, as we are seeing cases, and every case potentially could be suspected. For instance, this woman came in purposely for gynecological procedure, and this finally it ended up to be considered to review and investigated as COVID. So we have shared the various guidelines and operating procedure with them, what to do. And then the logistics supply, we suggested that individuals, they have to support and take steps to get some for themselves. As what we have, we shared and give some through their leadership.
Right. Doctor, I was asking about the number of checks that have been carried out. For instance, is the Ghana Health Service able to tell us the number of health facilities in Ghana, public or private, which have currently been prepared to receive and deal with any possible coronavirus case?
The training and preparation has started and it's ongoing. And it's not being done at the national level alone. Within the regions, the district, whatever they do in preparation, we have directed and instructed that the private facilities within such regions should be part.
So do we know the number we've reached out to? Have we checked to see on a regional and district level if these people have
PPEs? It has started and it's ongoing, but then the total for which region, how much? But then I know that the regions actively have started training for the staff. We started as cascading training, building capacity at the national level, at the regions, and then the regions are training within the regions and also the district.
Thank you very much, Dr. Bedu Sarkodie, for joining us. He is the Director of Public Health at the Ghana Health Service. You're still live on The Pulse here on the Joy News channel. My name is Daniel Daze. The Korle Bu Teaching Hospital released a statement in relation with this particular issue, and we have it on the screen now. It says here, US-based Ghanaian woman who needed gynecological services had booked an appointment to see a doctor in the hospital. The said woman arrived 5 days ago. She reported at the maternity block, was admitted for gynecological procedures. In the process, it was detected, that she had high-grade fever. Her history revealed she had traveled from a country and state in the US where COVID-19 had been diagnosed. She had also had mild respiratory symptoms and met the case definition for a suspected case of COVID-19 as defined by the Ghana Health Service. So they went on with laboratory investigations that were done. You see there, she was in a single room on the 6th floor of the maternity block. All staff who attended to her were given PPEs, and she was reviewed as of this morning. So this statement was put out before the case was tested. But now what we know is that this woman has tested negative for COVID-19. You are live here on The Pulse here on the Joy News channel. We end the bulletin on a sweet note, if I can say, because today, well, not ending the bulletin, but before, still ahead in the bulletin, we are holding the Adum Fufuo Party. Now, this is an event that goes on the 6th of March every year. It brings viewers of Adum TV and listeners of Adum FM from all over the country to the premises of the multimedia group, where they enjoy a delicious bowl of fufu and any soup of their choice with their favorite Adum TV personalities.